Thank you. And it will be pretty quickly because, as many of you all know, our report can function as a little version of the New York phone book. It could be a doorstop. It can be a weightlifting instrument. The final books will be ready by the end of June. They'll weigh a little over 4 pounds. So we're not going to try to talk about every message that is consonant, I think, in our report and the findings. But we do think that there are some that are worth highlighting here, and then hopefully we can get into further discussion during the moderated Q&A. But I would say overall, in many cases, the scope of many of the GAO studies has been more granular and a narrower slice than what we were responsible for in the scope of our study. And in those times where we had those collegial relationships, we did talk about us having scope envy. But all figuring out a way to make them manageable. But I think because of that, there are a lot of complements in a lot of key topic areas of critical importance for PEPFAR among all of the studies. Another thing to keep in mind is that our studies were operationalized differently. Some of the major differences for us is that we are required to work by a consensus process when there's a consensus study, and in this instance, we had 20 expert volunteers from around the globe who had to come to consensus on everything that we said in this book. We had access to different data sources, and though we both had access to qualitative and quantitative data sources, which means we're using some mixed methods, there were differences between the data sources that were used. The Institute of Medicine is, for federally funded studies, is required to adhere to the Federal Advisory Committee Act rules, which essentially is a transparency requirement for the public to be able to understand what the committee used in terms of information or data provided by agents external to the committee for the committee's deliberations to reach their conclusions and recommendations. We, as in the Institute of Medicine, is external to the government. Though we were chartered by President Lincoln, we are not a government entity. Many people want us to be a government entity, and a lot of our work is congressionally mandated. And as we have seen with the GAO, both of the PEPFAR studies that have been conducted by the IOM were actually congressionally mandated, either in the authorizing legislation or the reauthorizing legislation. Another difference is that the GAO reports are reviewed by agency before release, whereas the agencies or the sponsors do not review our reports before they're released, nor are they allowed to comment and that become a part of the public report. But the IOM does go through an external peer review process, and that peer review process is intended to add rigor to the quality of the report. And most of the time, the reviewer panels, and it's a blinded review, that the reviewer panels' expertise sort of mirrors that of the committee, but also looking for people who will be very critical of the report because the interest is, of course, in providing the best report possible. There were some methodological differences. You've heard Jim described a lot of the methods for their studies. And hearing that GAO is using identified case studies while the IOM used de-identified, purposely sampled, in-depth studies across multiple data sources and triangulated across all of those findings to be able to have findings and conclusions about the whole of PEPFAR. If you've been to any of our events by now, you've heard that we made 13 country visits. That were 2 weeks long for approximately 140 person weeks for all staff, committee, and consultants, and conducted 400 interviews, 68 site visits, and also did some primary data collection with those interviews, but then also did some secondary analyses with programmatic data and clinical data and financial data. So what we would like to do is sort of go through these reports as they have identified them in the sequence and just talk about some general findings and things that struck us. And so they may be related messages, but not necessarily duplicative messages. For the program planning report, the recommendation that PEPFAR really assess what needs to be reported PEPFAR-wide and what's used centrally for program planning versus what needs to be collected and used at different levels or different sub-levels of the program are really messages from one of our knowledge management recommendations as well that calls for a complementary portfolio of evaluation activities to assess outcomes and effects that aren't routinely or regularly captured by the monitoring and evaluation or the program indicators. There's also a lot of resonance in terms of the findings about data quality along all the different levels, both in terms of the challenges and the efforts to address them, whether it's any particular technical area. We found that that was sort of an issue across the board. For the evaluation report, I would say that a related message is that evaluation efforts are not always distributed to the areas of greatest need, and where there are large knowledge gaps in effectiveness and programs implemented at scale. And one of the things that I saw on Todd's slides were calling for PEPFAR to develop evaluation plans. That also is very resonant with the knowledge management recommendation that's calling for a comprehensive knowledge management framework, which includes program M&E strategy, as well as a prioritized and targeted research portfolio, and systems for knowledge dissemination. So recommendations for a more strategic and coordinated evaluation approach as part of that comprehensive knowledge management framework, and capacity building for evaluation at country level is also resonant with our evaluation, with our knowledge management recommendations, and we actually have some very specific implementation considerations that go along with that. Of course, there is always resonance in terms of recommendations about dissemination, and while PEPFAR has made a tremendous contribution to the global knowledge base, and it's been remarkable, at the same time, there have been opportunities that have been missed to make this information, I think, more timely and usable and findable, not only online, but also some sort of need for systematic data sharing, including country-to-country sharing. And that was one of the things that we heard quite a bit about in our field work, not so much that it was a requirement of PEPFAR necessarily, but that country teams were eager to find ways to be able to share information, best practices, and understand things that were working, and how they could also provide that kind of technical assistance to their peers.
So for the treatment cost and results studies, I'll say a few words about that. In the treatment cost, our evaluation included a brief review of the efforts and the achievements that PEPFAR has made in terms of efficiencies and strategic use of resources in treatment and in other areas as well. But certainly this is an example where the GAO did a much more in-depth with a lot of data that we did not use in our report in order to really make very concrete, specific findings about that. So there's a nice complementarity there. Certainly there's one resonant message in both, which is really about the stark reality of the large unmet need that remains in the HIV response. Despite the amazing and remarkable contribution to meeting the need when PEPFAR started, the reality is that there's still, a large coverage gap, and discussing a lot of the same issues that are faced not just by PEPFAR but by all stakeholders in the global response, being compounded by the expanding eligibility criteria that are emerging, and that really leads to a difficult decision-making that has to happen about the best use of limited resources and the realities of that going forward, and really all stakeholders, not just PEPFAR, but also other bilateral donors, multilateral organizations, and the countries themselves about how to prioritize coverage for antiretroviral therapy, which is not just expanding coverage ability. There's a large unmet need. Even if you went back to the old CD4 count guidelines, there are still people who aren't covered who need to be under those original guidelines, the expansion to the 350 threshold, the B+ expansion, covering everyone who has TB, serodiscordant couples. So there's a lot of, across the whole spectrum of need that's going to come into play. And part of that decision-making process is the potential that any one of those coverage priorities, if they're emphasized, has the potential to exacerbate existing disparities in access and coverage. And that's a really difficult part of that decision-making process. So, option B+ will put a high priority on pregnant women, but there's the IOM report reflects the large difference between coverage for men and women. So is that going to expand that and have even fewer men getting into coverage? Will the expansion of some of the serodiscordant couples, will that lead to some of the populations that have been more difficult to reach, some of the marginalized populations or remote populations, transient populations? So these are just kind of acknowledging how difficult that process is going to be for PEPFAR and for all the other stakeholders involved. And that's kind of goes beyond just where will the resources come from and how much will it cost. So that's that issue really drives home the importance of having this kind of expenditure data to really be usable and readily available, and also more readily linked to program implementation data. So, thinking not just about the planned funding, but the actual expenditures, thinking about more comprehensively the cost of treatment, because different people will be buying different components, as was raised in a question. But ultimately, that needs to go into a national picture for what the plan is going forward. And so the need for that kind of data to be a part of the process is really clear, but also recognizing always the dilemma between needing more data and the burden of getting that data and doing that analysis. And so kind of recognizing that that's an easier thing to say than to actually do. Again, limited resources, and how many of those resources are going to go towards data collection versus implementation. These are all kind of real dilemmas that the report certainly tries to acknowledge and contribute to sorting it out, but recognizing that that's not an easy task. I think a part of that is that the recommendation in the sustainability chapter to Kimberly and I always try to be living, walking table of contents for people, because we recognize it's very hard to get through everything that's in here, so try to always tell you where to go. So in the recommendation focused around building sustainable responses, which is recommendation 10.2, really focuses on, in a similar way, the need to be looking at these projecting of costs, projecting of resource needs for different scenarios that countries might be choosing in terms of the priorities that they decide to go with. Needing to do that systematically by country. So not just from a central perspective using the best available data, but from a country perspective using what data are available in the country, local data, current data, data when possible from systems that already exist in the countries, and data that's more comprehensive across the costs, so including non-PEPFAR costs, very similar message. And there are some examples. The South Africa Partnership Framework Implementation Plan has some of these elements in terms of working with the countries with the data that are available in the country, which we could talk about a little bit more later if people are interested. And along with all of this goes a capacity building need, because in the push to have things be happening more at the level of the country, these issues of data use and understanding how to use that data, there's going to need to be investment in building the capacity to do that kind of financial and economic analysis as part of the planning process. And that's recommendation 10.1 really focuses on a shift to longer term types of capacity building. So the enormous contribution PEPFAR has made in terms of capacity to implement a response to HIV is goes, I was going to say goes without saying, but actually it goes with a lot of saying in this report. But that shift towards that from a management and planning perspective of really having longer term skills through degree programs and other more comprehensive training to really have those skills in place. And part of that is also developing, or in a lot of cases applying already existing benchmarks about these issues, about resource mobilization and financial planning, and this being as much a part of PEPFAR's support as the service delivery. And a final thought on that is that this is, of course, not just applicable for antiretroviral therapy. This is true for all of the programs and services in the response, which all cost money. And if we think that there's limited data about ART, there's even more limited data about most other things that are happening. The more comprehensive care that was raised in a question, some of the other clinical and non-clinical services that go along with taking care of a person who's living with HIV, and then also other broader programs, OVC programs, prevention programs, gender programs. All of these are currently a part of what PEPFAR is supporting, part of what the hope is countries would continue to support as part of a comprehensive response, and how will we plan for the resources for that. On the results side of the treatment study, Certainly, a lot of resonance in the need to shift to measuring outcomes and quality, and really understanding that not just in terms of the current programs, but also in a way that we'll know what's happening with those elements of the program as a transition is being made to a more country-focused implementation strategy and a more local implementation strategy. And I think one point to raise in the knowledge management recommendation, which is Chapter 11, is this strategic thinking about data gathering and data use and data reporting, and what is it that really needs to be reported all the way up in the aggregate across the whole of the program versus what needs to be happening at the country level, at the program level, and is there potentially some room in there to try to manage the burden, if not the data collection burden, at least perhaps some of the reporting burden? Are there some ways that that might be a little bit of room to strike that balance between the data needs and the burden? Certainly the critical challenge of what's going to happen as programs transition. And Chapter 6 is our care and treatment chapter, and there are two recommendations in there. One is really about understanding more efficient, effective, quality service delivery models as this transition is happening. So that's certainly one key recommendation. And then there's also a recommendation about having some longitudinal data. So the committee in this case, among the different things that you might need to know across multiple countries, across maybe not the whole of the program, but at least a good representative multi-country sample, treatment outcomes is one of them. So and I should say care and treatment outcomes, so not just ART. So trying to find ways using not an elaborate research cohort, but some nested program monitoring efforts so that there are some ways to understand what's happening as the program is shifting its implementation approach and what these different models are doing. So highlighting that is one area where there will be a need going forward to know some things across the whole of PEPFAR and not just at the country level, in part because of the opportunity to learn from country to country, in addition to still understanding what the PEPFAR dollars are supporting. And this dilemma about country systems is also a strong message in the report. It's ideally, you would have country systems in place that would be able to tell whether or not, as we transition, things are working as well as they were before, and you're seeing the same level of quality and the same level of results, or even perhaps increasing results. But you can't wait for those systems to be in place in order to start the transition process. And PEPFAR will still have a responsibility to track that it's supporting quality services. It goes back to almost the emergency phase dilemma of having PEPFAR systems for data collection versus country systems for data collection. If you're responsible for knowing the information and you can't rely on the country system, you have to have something else in place. So that back and forth of trying to do those things in parallel is a difficult challenge for PEPFAR. But based on the data gathered and presented in our report, the current capability really does vary greatly by country, and also by examples within some implementing partners and countries. So there's, overall you might say systems aren't in place, but there are some examples where a lot of progress has been made in great part due to PEPFAR's contribution and to partners that PEPFAR is supporting and to activities that are happening in partner countries. So the potential for accelerating progress across countries might come from some learning across those countries where there are better systems in place and where there are some examples in place. And finally, on the treatment front, there's a strong message, which we've already recognized, everyone realizes is important, is this shift to understanding contribution. Given less support for direct provision of services. And really developing credible ways to do this is going to be critical for PEPFAR. And one of the messages in the report is that it's not only critical for PEPFAR, but it's an area where PEPFAR can, again, be transformative in helping the sort of global health and foreign assistance community figure out how to do this. Because in every domain this is being faced. If we want things to be more country-led and country-driven, then we aren't necessarily going to be doing a dollar-to-dollar attribution. And in many ways, the shift in activities means that proportional adjustments aren't going to be sufficient. Because if you're doing capacity building, if you're establishing medical schools, how are you ever going to figure out what the proportional number is? There's going to have to be some alternatives to just kind of dividing up the funding proportion among the results. So really understanding how that works is going to be a critical part of the future. And all of this, of course, again, is applicable to more than just treatment. One thought on the data use that came up in the question and answer is, again, that our report has a strong message about this shift to long-term capacity building in terms of kind of all of the domains of capacity that are really going to help going forward, and understanding whether or not those efforts are working and what contribution they're making is going to be a key piece going forward.
And for the last report on supply chain, but before I do that, I'd also like to add something to Shannon's question about data use and availability and utility in countries. And we spend a lot of time asking people about how they go about making decisions and allocating resources, and what data or evidence do they use across the programs, whether it's really sort of provision of clinical or non-clinical services, policy making, establishment of guidelines, et cetera. And I think some of the things that we found out of that is that it's variable, of course. But we saw incredible use, as Bridget was saying, sometimes at the facility level, sometimes for policymakers and national or subnational governments, and sometimes it swings just the opposite. But we did sort of consistently hear that there was sort of a hunger for data and the use of data. But part of what drove that was whether there was a comprehension issue. Did people really understand the data that they were collecting? Or was there a frustration issue? And it's certainly everything in between, but I'm going to pick the polar opposite. Was there a frustration issue that the data being collected had limited use for what they needed? So in all of that, I think, and part of what we heard, and the reason that I wanted to bring this up is in terms of, we've been talking about this in the context of monitoring and evaluation, but some of the strongest credit was given to PEPFAR in terms of its contributions also in terms of health information system development. With big strides in laboratory information systems, big strides in some different countries, and this is my segue back to the supply chain report, in some countries, supply chain information systems, where, and we again saw based on our sample and where we went, there is similar recognition of the contribution of PEPFAR's progress in terms of the development of supply chains, or the capacity building, or the technical assistance in all aspects of supply chain or supply chain management, as well as the challenges. And we saw examples of where supply chain was working extremely well in countries, that was being evaluated by one very critical or universal indicator that everybody is always wondering about: how many stockouts do you have and of what, over what period of time. And in some places, people felt as if supply chain was an area that they could manage or sustain on their own if they had to, and felt that it was very strongly country-driven, even with its challenges across all the 6 elements, and those same 6 elements we looked at. And in some cases, people were scared to death that they were going to have that responsibility, and people recognizing that, particularly when national government was not ready, and then taking incremental steps. So we saw the gamut of that, and the human resource constraints were certainly also there, but we also saw examples of where people were sending their staff to be trained, and it being considered a professional skill in terms of supply chain management, and others where they had human resource constraints, and even the issue of retention. In some places, we saw people who worked in supply chain in one country moved to another country, but still worked in supply chain. So again, we saw sort of the gamut, but I think that there's certainly resonance in the messages of our report and our chapter on health system strengthening, speaking of table of contents, which is where chapter 9, which is where we talk about supply chain. Also, certainly to the emergency procurement mechanism, just wanted to mention that. I think particularly in the chapter where we talk about sustainability and PEPFAR's efforts to be able to assure sort of maximal operation and synergistic operation of the Global Fund, and the technical assistance is being provided at the field level and at the headquarters level. I certainly think that the emergency procurement mechanism can certainly address a lot of the bottleneck problems that aren't PEPFAR driven, which OGAC talks about in their public comments to the GAO report. Supply chain is critical to sustainability. Everybody knows that. And the goal of maintaining uninterrupted care and treatment services, and to help maximize the efficient use of limited resources. But as Bridget mentioned, there's inherent tension, again, in building a national supply chain that's owned and run by entities in a country and the national government and ensuring a reliable supply at a minimum cost. So what happens if they don't have access to the pooled procurement that, and the proven performance over a multi-country sort of PEPFAR specific system? And so when Bridget was saying we're talking about the difficult choices, if we're going to transition to country ownership and having countries lead and sustain more of these specific discrete activities as well as the processes and the dynamic systems that are needed to be able to provide services. Difficult decisions do have to be made. The capacity building, the technical assistance that we saw and heard about in country are really aimed at saying, what are we going to do and how are you going to maintain this and what are the consequences? I think that was part of what we heard as well, is that people were willing to take on some of the responsibility but didn't want consequences if things did not go well. I think that there's a similar dilemma to the monitoring of treatment results, and again, talking about health information systems or information systems that are needed for monitoring, planning, and management of supply chain. And again, that's an example where I think time will be revealing of how well that is working in countries, specifically in terms of the activities in South Africa. GAO identified the similar elements, that very nice graphic that you had of the 6 elements of supply chain, and it seemed like that your findings focused more on the front end of the chain, sort of front end, and then skip to the consequence on the back end if things don't work well. And I think that we, in the IOM report, found some very good examples and some very poor examples throughout the entire chain. Of if you use the 6 elements as a scorecard, so to speak, that there were some that were hitting 4 out of 6, 5 out of 6, 6 out of 6, and some that it was just, people going in and trying to rescue and being able to figure out how do they keep the supply chain working in a country. So I think that there's consensus that there is obviously a need to strengthen all of the elements across supply chain, but this was an area where PEPFAR received pretty high marks from a lot of interviewees and in terms of when we talk about our interviewees, we had a very a strategic, purposeful sample in looking at from national stakeholders to subnational to people in the private sector, other people in the public sector, non-governmental organizations, academia. So this was an area I think that people recognize how important and how fragile the systems can be in some countries. And the surprises that happen when people think that they're doing well and sort of caught off guard because of something that sort of unravels. And they end up dealing with the consequences. But it is an area where PEPFAR has been given a lot of credit in terms of how much systems have been strengthened and how to deal with each of the elements within that system for good, efficient management and undisrupted service.
Kind of a final overall resonance from a lot of the presentations and comments that you made, and it's the case for our evaluation as well, that a lot of these are issues, critical issues that were already recognized by OGAC, by the implementing agencies, by the partner countries themselves. So these are issues that are being discussed robustly and grappled with, and the stakeholders are struggling with them. And in many cases, the recommendations, I think, in both the set of GAO reports and for the IOM report as well, are areas where what's being recommended by these external evaluations are consonant with steps that are already being taken within the PEPFAR program or that are being launched or that are being initiated. And so I think there's the potential for these reports to hopefully reinforce those, to expand in some areas where there might not have been quite as much developed, and help to continue to evolve those things as they're being implemented and moving forward, so that there's some consonance with the direction that the program is already going. And I think that's reassuring. It's a program that has a lot of maturity and really has invested a lot in its monitoring and evaluation and understanding its own effects, and that in many ways shows in that consonance from these external efforts. That's a final thought, and then we'll move on to some discussion. So I'm going to change identities.